January and February are part of the peak of flu season, but another virus, shingles, also tends to spike this time of year. Shingles is normally a skin rash, but in 10 to 20% of cases, it can infect the eyes. Now, that form of the virus, called ocular shingles, can be a serious threat to your vision. And joining us now to explain the dangers of ocular shingles are Dr. Ravi Patel and one of his patients, Suzanne Mulvey, who actually had the virus. Good morning to you both. Thanks for being with us today.
Thank you for having us.
Dr. Patel, first of all, tell us, what is ocular shingles?
Well, shingles can affect lots of Americans. It can affect up to 1 in 3 Americans, and it commonly appears as a rash or a set of blisters around a set of nerve endings. However, in a small percentage of patients, it can actually affect the eye by getting a rash or a blister formation in or around the eye, and that would be known as what's called ocular shingles.
And this is related to the chickenpox virus, isn't it?
Correct. It is the same virus or the same family of viruses that causes the chickenpox at a younger age, and in middle age, more commonly known as fever blisters or cold sores, and as we get older, shingles.
And so really anybody who's had chickenpox could get this?
Correct. Whether you've had chickenpox or not, you are susceptible to getting the shingles virus at a later date.
And Suzanne, when did you have ocular shingles? When did that happen?
I first came down with shingles November 2014, and then it was March of last year that it went into my eye. So I'd had shingles for several months, and I thought that I was over it when it reappeared.
You must have been so scared.
Yes, I was.
What did it feel like? What did it look like?
It was very painful. My eye was very painful. And I really, of course, couldn't see my eye, so I actually had a friend take a picture of it, and I could see the ulcer in my eye. It was shocking.
And did it actually hurt in your eye?
Oh, yes.
And so you did the right thing and went to see your ophthalmologist.
Right away. I didn't take a wait-and-see attitude if it was going to get better. Fortunately, I had an ophthalmologist that I was familiar with, and she recognized right away that it was a dramatic situation and referred me to Dr. Patel.
And because you don't want to mess with your vision.
No,
that's one thing that you...
Absolutely not.
People can learn from you by getting right on it. Dr. Patel, is there a way, first of all, to prevent this, and then if you do get it, how do you treat it?
Well, first and foremost about prevention. You know, some of the best things you can do as preventive medicine, and Ms. Mulvey did this as well, is get the shingles virus for adults over the age of 60.
The vaccine?
The vaccine. That greatly reduces the chance of you developing shingles. That is not a guarantee that you will not get it, but it definitely helps reduce the likelihood of you getting it. The other thing that Ms. Mulvey did, which was a great thing, was immediately getting attention. If you notice immediate redness or irritation or things of that nature, very important for follow-up.
All right, well, thank you both, Dr. Patel and Suzanne Mulvey, for joining us this morning. If you missed any of the information that Dr. Patel mentioned, don't worry, we're going to be posting this entire segment to the morning show page of News4Jax.com. Just look under the videos tab of the morning show page.